Yeah, so welcome all. Thank you so much for joining again in an exciting and informative session. We have Dr. Rini Vora from Maharishi Ayurveda today with us, and we are looking forward for a very informative session. आप सबका स्वागत है. आज again we have Maharishi Ayurveda with us, and Amrit Kalash, which is like known as the king of Rasayana, or sometimes some people are referring it as a queen of Rasayana, and one of the most exhaustive research based Ayurveda product, I would say, we'll be seeing and we'll be looking forward for a very informative session. So, Dr. Rini Vohra, by the way, she is a pharma graduate and she has done a PhD in health economics and outcome research. It is a very interesting subject and very interesting field which analyze and overall the entire research model and the methodology has been studied by her from US, West Virginia University. And right now, she is the chief scientific advisor in Maharishi Ayurveda. And her work is primarily understanding health outcomes for diverse patient populations using different study designs. During her PhD, she has focused on examining healthcare and economic burden on adults with autism and other mental health disorders. She also worked briefly with University of North Carolina on understanding the impact of opioid use on US populations and examining physicians' perceptions for the same. And currently, she is handling the clinical and outcomes research department at Maharishi Ayurveda Private Limited. So, thank you so much, Dr. Rini, for joining us today. Very interesting profile, I must say, and very few people are there with these kind of education, qualification, and background in Ayurveda to take care of the research in a scientific and technical manner. So, we are very much pleased and happy to understand that a person like you is taking care of the research aspects of Ayurveda products. That is remarkable because personally, I have also worked in various corporates as far as research is concerned. So this type of qualification and this type of experience is very much required in Ayurveda. So we appreciate and we sincerely looking forward for your informative session today. And I request all the doctors, students, and audience who are watching us. We are live right now on Facebook, YouTube, Periscope, and on our website, that is indianvadyas.com/webinar. So आप सब लोग अपने अपने questions को post करें. Feel free to post any questions during the presentation also, but we will wait first Dr. Rini to deliver the entire presentation, and then after the presentation we will start taking up your questions. हालांकि आप सब लोग प्रेजेंटेशन के बीच में जब भी आपके मन में कोई क्वेश्चन आए, आप हमें पोस्ट कर सकते हैं हमारे वेबसाइट पे, चैटबॉट में आप सेंड कर सकते हैं अपना क्वेश्चन, एंड वी विल डिस्कस योर क्वेश्चन आफ्टर द presentation today. So, Dr. Rini, over to you. And again, thank you so much for taking time and joining us today.
Thank you, Dr. Piyush, for the lovely introduction. And just a few comments about, me participating in Ayurveda and taking this forward. I'm actually lucky to be, participating and having the opportunity to take Ayurveda forward with whatever expertise and experience I have. And honestly saying, whatever interactions that I have with all the US agencies, they are looking towards Ayurveda because there's nothing else out there for a lot of chronic diseases. And now they're, moving towards the direction of, coming into Ayurveda and doing more research in Ayurvedic products. So I think I'm just lucky to be here and happy and excited to share whatever research we have today. And a message to the audience that today's session will be primarily on, sharing the scientific research uh, based on a lot of different researches across the world on a product called Maharishi Amrit Kalash. So if the session gets too technical, please do reserve your comments or like your questions towards the end, and I'll be happy to answer them. Is everybody able to see my screen?
Yes, yes, you can
Dr.
have.
Piyush? Okay.
Yes, if it is there, you can start. Right.
Okay. I'll talk about the scientific evidence and benefits of Maharishi Amrit Kalash, but my first vote of thanks actually goes to our guiding light, who is His Holiness Maharishi Mahesh Yogi Ji, because of whom we have everything that is in Maharishi Ayurveda. All the products, all the research has been, supported, has been guided by him. So we are really thankful to him for bringing this knowledge out in the world. And talking about research at Maharishi Ayurveda, we are a company which does research across the entire world, across the entire globe. So these are some of the universities in the USA, Netherlands, India, Canada, Japan, um, and some parts of Europe as well, other than Netherlands, which have conducted research on Maharishi Ayurveda products. In India, we have conducted research in SMS Medical College, Jaipur, All India Institute of Medical Sciences, Delhi, and King George's Medical College, Lucknow. So our products we have a wide variety of products, but broadly they can be, the research has focused on oncology, anti-aging, immunity building, organ functioning, cardiovascular system, antioxidant system, and gene regulation. But today I will be focusing on this, as Dr. Piyush said, the queen, king, or as we at MAPPL call it, the super rasayana, Maharishi Amrit Kalash. So what is Maharishi Amrit Kalash? I'll just go briefly into it, for the audience who were not able to attend the previous webinar. So this Maharishi Amrit Kalash is a two-part formulation made up of a paste, which is this big bottle, and a tablet, a bottle of tablets. The paste is also called Max 4 or nectar, and the tablet form is also called Max 5 or ambrosia, right? So this Amrit Kalash, the two-part formulation, is a very meticulous combination of 53 herbs which work synergistically together to do a lot of, functioning in our body. So this particular 53 herb combination is not very simple or very straightforward. It was created by three Vedyas, out of which one of them was Padma Shri, I forgot his name, but very prominent Vedyas. One was Balraj Maharshi ji and the other was Panchi Triguna ji. So Amrit Kalash was created by these three Vedyas and they came together to find one solution to everything, right? So what happens in this Amrit Kalash is when you make it, you put a lot of herbs like Ashwagandha, Mandupirni, Giloy, Chandan and Mulethi, Nagarmot, Shankpushpi, Shatavari, Punarnava, etc., etc. Some of them are rasayanas themselves, like something like Amla is a rasayana of its own. But when you put all the rasayanas together in this one combination, what comes out is the king or queen or super rasayana, right? The beauty about Amrit Kalash is that it is not only this, simple combination, it is also the most intensively researched Rasayana, Ayurvedic product, and I should say Ayurvedic proprietary product out there, which has been researched so well, and not only in India, but all across the globe. The benefits of this Amrit Kalash are not restricted to just overall health. It is not only something that is antioxidant in nature, it is also an anti-aging agent, a revitalizer. What it does is it keeps our arteries clear and healthy. I'll talk more about that. It improves our immunity, our stamina, reduces fatigue, then overall, you see that there's a change in your overall working. You're able to perform better, you're able to be more productive. Also, you become biologically younger. Biologically younger matlab ki ek to hota hai physically, you feel like on the outside, on the superficially, you look younger. But biologically younger is that actually what are your cells like inside? Are they the same as that if you're a person who's 20-year-old? Are they the same as a 50-year-old? So what we know from the research on Maharishi Amrit Kalash is that people become biologically younger. The premature aging जो लोगों में होती है वो काफी कम हो जाती है when they start taking Amrit Kalash. So let's talk about the scientific evidence. More than 75 studies have been conducted across the world, out of which 58 studies are preclinical in nature. प्रीक्लिनिकल का मतलब ये है या तो वो इन विट्रो या लैब स्टडी है या तो फिर वो एक एनिमल स्टडी है, राइट? 15 studies have been conducted among humans, Some of them are, observational research. That means just doing a survey study, and some of them are randomized controlled trials. And seven other studies are basically looking at, the standardization of Amrit Kalash, or how it works well as a part of a multimodality treatment. And the overall review of this research is that MAC is not something that will work on one organ system, या फिर on one cell functioning, or on one type of cell, or on one type of neuron. What MAC does is it works on a variety of, organ systems. It works on the entire mind and body system to bring the synergy, the soul and the body together, right? And अभी तो आप ये सोच रहे होगे, अच्छा, how does, everybody says that, all the Chavandprash, they say that they're bringing the soul and bringing the mind and the body together. But today's session basically is to back this claim up with the list of scientific evidence that I provide to you today, right? So we have divided broadly the actions of MAC based on its scientific evidence into five broad categories. First, we'll focus on overall health. Overall health कैसे improve होती है with the use of Maharishi Amrit Kalash. What are its antioxidant and anti-aging effects? Immunity, how does that improve? How does it ensure a better heart health? Then finally, how is MAC a chemopreventive, anti-neoplastic, and how does it protect us from chemotoxic effects of a lot of drugs that are used during chemotherapy? So let's look at overall health. What MAC does is, what studies have shown, and most of these will be, animal studies or lab studies, that it balances liver functioning, kidney functioning, pancreatic functioning, and a lot of blood parameters. ब्लड पैरामीटर्स में काफी चीजें आती हैं, जैसे MCHC जो है, एक ब्लड, कभी भी CBC, whenever you go to get a blood test done, you go get a CBC report. उसमें one of the things is MCHC, which is a good parameter, basically tells you how, your how your blood is, the quality of your blood is. So MAC is directly improving blood parameters like those. Directly in research, it has been shown that it improves resistance to illness, less headaches होते हैं जिन लोगों को migraine होता है, less fatigue experience होता है, and allergies जो हैं बहुत लोगों में कम हो जाती हैं या फिर उसके symptoms बहुत improve होते हैं with the use of Maharishi Amrit Kalash. MAC also reduces a neurotransmitter called substance P, which I'll talk more in detail in the next few graphs. It enhances your memory and associative learning. What it does is, आपका कोई भी visual discrimination task performance है, and this study was basically done in older adults to see whether those who take MAC are their visual activity, is it much better than those who don't take MAC, right? What MAC also does is it improves your overall mood, आपके psychological well-being. Among patients with depression and anxiety, it was seen that they tend to score lower on depression scale and anxiety scale when they're taking MAC. There is a lot more mental clarity and emotional balance when somebody is taking MAC as well. Finally, directly also in blood, we have seen that mood and well-being को जो imipramine एक drug होता है, उसके जो receptors को जो है वो inhibit करता है MAC, right? Imipramine basically it kind of modulates your mood and well-being, and when MAC inhibits that receptor, it basically also helps your mood and well-being to elevate, right? So let's look at this graph. This particular study was done as a survey study, and what we saw was that 87% of these people who were asked how they're doing after taking MAC for a period of time, 87% of them reported greater resistance to illness, 84% reported greater happiness, tranquility also increased, was shown that 83% people felt they were more calm after taking MAC, and mental clarity and emotional balance, as I talked to you, that it was much better after taking MAC. इस study में only 1% of the patients showed no change or the condition worsened. Effect or improving symptoms of various illnesses. Those who suffered from these disorders like headaches, asthma, cancer, rheumatoid arthritis, they were asked the question, how are they feeling relating to the disorder they're suffering from? So those who were taking MAC reported that they had lesser number of colds, like 94% reported better symptoms. Those who had cancer reported, 90% of them reported that their symptoms were getting much better. Rheumatoid arthritis patients also reported that they were doing much better with their pain, etc. And these are the list of all the disorders where different proportion of people basically, and this is a very high proportion, like 94% and 84%. A lot of them are saying that after taking MAC, their symptoms, it's not a cure, but it definitely starts improving in that direction. So as I said, like after 3 weeks of MAC use, आप directly देख सकते हैं that as compared to control, the MAC group, which is the blue group here, उनमें attentional capacity या alertness is much much higher, and this continues even after 6 weeks of MAC use. Right? This is the control group. The red one is the control group, and this is the MAC group. And MAC group shows that their alertness or their visual discrimination is much better than those who are not taking MAC. And this was a double-blind placebo-controlled study. What does that mean? Double-blind, as in neither the physician nor the patient knows what they are taking. And placebo control, as in the control group is the placebo group. That means they are taking pills but does not have any active ingredients, right? Okay. Again, before MAC, you see the substance P, जो एक neurotransmitter होता है, which is associated with your pain pathways. It is also a neurotransmitter which is associated with gastrointestinal and pulmonary inflammation. What was seen was that after the human subjects, they took MAC, there was a significant reduction in the value in the quantity of substance P, basically indicating that MAC could also help in pain pathways, in reducing pain among all these people, which you can also see back in the graph here. If you see those with rheumatoid arthritis, something which is a pain related condition, a lot of them also reported that they were doing well with their symptoms. So this substance P, basically इसका blood में कम होना could also mean कि MAC का एक mechanism है कि substance P को कम करके pain and inflammation को control करना, right? Okay. Now let's talk about antioxidant and anti-aging. There are a variety of it. So MAC is a very, very strong antioxidant. It's probably the strongest antioxidant out there, which is an Ayurvedic based product. And I say that with a lot of confidence because I have at least 30 to 40 studies conducted on MAC, which have proven that the antioxidant capacity of MAC is very, very high, and it's an extremely potent antioxidant. How does it exactly do that? First is hepatic microsomal lipid peroxidation. It's a very complicated line. I'll simplify it for you. Cells में एक जो membrane होती है cells की, the cells have a membrane which has a lipid barrier. Basically, anytime a cell will be damaged, will be crossing that lipid barrier, right? So once that lipid barrier is crossed,
Dr. Rini, can you just unmute yourself, please? Can you just unmute yourself?
Hello?
Yes, please. Continue.
Okay.
And you can also do the full screen. Yeah, perfect. Please start. Yes, perfect. Okay. Please start.
So basically what happens is hepatic microsomal lipid peroxidation. Lipid को peroxidase करना मतलब lipid को oxidize करके कोई भी damage होगा, right? So what MAC does is it controls that lipid peroxidation. So if there is anywhere a damage in the body, MAC protects the cells by not allowing that or delaying that lipid peroxidation, right? So that is one way that MAC protects. The other way is MAC will directly scavenge. And scavenge in simpler words is eat or like basically attack the superoxide and hydrogen peroxide radicals, right, which are basically free radicals, which are very damaging to the cells. Everybody knows that, right? So MAC will not only protect the lipid barrier, but also scavenge the free radicals itself. It also reduces LDL oxidation. LDL oxidation मतलब basically LDL भी atherosclerosis से linked है, जो I think everybody knows. So it also reduces the capability of oxidation of that. The other ways, and there's a lot of information out here, so I'll not cover everything. I'll go in specific if somebody has a question. It also suppresses inflammatory mediators, जिनमें से काफी सारे आपके इंक्लूड होते हैं कभी भी कोई there's an immunity attack or something like that. Decrease phagocytosis and lymphocyte blastogenesis. मतलब lymphocyte, which is your basically T cells, which are the army of your body. They protect your body. Lymphocyte की blastogenesis, lymphocyte की भी पूरी जो protection है, उसकी priming है. That is also what MAC does. In terms of anti-aging, what MAC has shown in studies is it reverses age-associated pathological changes such as cholinergic deficits in brain. हमारी brain में choline and choline based बहुत सारी चीजें होती हैं. जो भी deficits होते हैं brain में या जो भी brain disorders होते हैं, some of the other way might be linked to choline, right? So that cholinergic deficits is also something that MAC takes care of, right? Another beautiful way that MAC works is preventing conversion of light Purkinje fibers, जो अपने CNS and brain में होते हैं, these fibers. It stops or prevents their conversion to dark neurons. Dark neurons basically in a crude way basically mean dead neurons or dead cells, right? So मैक में ये देखा गया है कि हमने ये ब्रेन में चेक किया कि वो लाइट न्यूरॉन्स को डार्क न्यूरॉन्स में कन्वर्ट होने में डायरेक्टली it stops. That means whenever one is using MAC, they are able to regenerate or not allow their brain cells to decay as fast as normally a person would, right? So that's also one way where MAC is a really good and strong anti-aging product. This particular study, basically, I want you all to focus on the triangle. So these triangles, this triangle is basically MAC. यहाँ पे हम बता रहे हैं इसका total antioxidant status. So this is covering oxygen radical absorption capacity, which is called ORAC. ORAC का मतलब basically ये होता है what is the antioxidant. It's basically a measure of your antioxidant capacity of any product out there, of any ingredient, right? So what MAC does is at 0 hours, once one takes it, it has shown that in these 3 subjects, MAC consistently increases their ORAC values, right? Starting from 0 hour to 10 hours to 24 hours. And the comparison group here, for example, is 500 gram of oranges. तीनों सब्जेक्ट्स में ये देखा गया था कि after 24 hours of MAC use produced a much higher ORAC capacity or an antioxidant capacity, which is similar to 500 gram of oranges. Although MAC4 जो अपना paste है, it does also go reasonably higher at 24 hours. If you see, it is always higher than 500 gram of oranges, but for our sake we'll compare it to that at least 500 gram of oranges का तो जितना antioxidant capacity होता है वो एक normal dose of MAC में within 24 hours you will be able to achieve it, right? So this is one strong place where you can see that MAC is a strong antioxidant. Then decreased oxidation of LDL में भी, which is LDL oxidation is associated with atherosclerosis development. It was seen that M4 and M5 are at least 1,000 times more effective than vitamin C, vitamin E, and probucol, which are 3 very common antioxidants in achieving less oxidation of LDL. So it was more potent than at least 1,000 times more potent than these three antioxidants, right? Okay. ये भी lipid peroxidation है. As I talked about, lipid peroxidation basically means that MAC, protects your cells. Anything that will reduce your chances of lipid peroxidation is basically protecting your cells. Here also it was seen that MAC7, which is the tablet form of paste, is at least 60 and 166 times more potent than vitamin E in reducing lipid peroxidation in rat liver microsomes, right? उसकी बहुत ही कम concentration पे, very low concentrations of these extracts of MAC, we were able to achieve the same lipid, reduction in lipid peroxidation as compared to vitamin E, resveratrol and riboflavin, जिनकी बहुत high concentration पे जाके, we're able to achieve the same target. Now let's talk about immunity. Immunity is also one aspect of Maharishi Amrit Kalash, which is not only associated with its antioxidant action, of course, that plays a role, but directly also Amrit Kalash, it has its own, strong actions in immunity. One is, दो तरीके हैं immunity को enhance करने के. First is, improving your defense mechanism, which is by macrophages. Macrophages are those cells which basically attack anything that is foreign at the site of infiltration. And the other is T cell proliferation, right? T cell, B cell, and lymphocyte proliferation, which are basically your immunity cells. What it means is that MAC not only improves your defense mechanism by proliferating T cells की production बढ़ाता ही नहीं है. What it does is it prepares the T cells in a way that it has enhanced responsiveness. That means those T cells in a normal person who does not take MAC will act probably, normally like normal cell proliferation. MAC will not only proliferate the cells, but also enhance the responsiveness of those lymphocytes. Secondly, what it also does is it increases nitric oxide production by activated macrophages. मतलब macrophages which basically attack anything that is foreign. कोई भी foreign चीज आती है या anything that attacks the body from outside. Macrophages produce nitric oxide to attack them, right? So enhancement of that production or by activated macrophages is highly done by MAC. There are a lot of other things like increased activity of these enzymes which help in immunity. Then directly also interleukins 2, interferons alpha and IL-4 production increased with the use of MAC. Finally, again, its antioxidant action, superoxide scavenging, and O2 and ion production in the presence of a stimulator also increased. Let's see its direct effects. Among 500 individuals who were asked how they were doing after taking MAC. So before 2 months taking MAC, their mean colds were about this much. And after taking MAC for about 2 months, their mean number of colds that they experienced significantly reduced. Now let's talk about stimulation index. Stimulation, the reason why I'm bringing this graph is for you to understand how MAC really works. Stimulation index is basically a measurement of the ability of the lymphocytes. Lymphocytes जो आपकी immunity cells हैं, basically your defense mechanism. So stimulation index measures the ability of the lymphocytes of how responsive they will be when they are challenged or when they are stimulated, right? Is graph mein we can see, as compared to controls, those who are taking MAC have a much higher stimulation index. That means their lymphocyte are at least 3 to 4 times higher in their responsiveness to any foreign body or any foreign attack, right? Okay. Now let's talk about heart health. Heart health may directly, there has been a study where we have seen that MAC directly reduces blood platelet aggregation and development of plaque and atheromas. Also, as we talked about earlier, increased resistance to LDL oxidation or LDL oxidation ka lag phase badhana, which I'll talk more in detail. Other things like creatine kinase and creatine kinase levels causing inflammation and muscle damage. जो भी चीजें inflammation और muscle damage करती हैं, MAC उन चीजों की elevated levels को reduce करने लगता है. Right, so whatever is responsible for inflammation in the blood arteries or muscle damage of your heart muscles, MAC starts reducing those things. For example, in this, अब मैं plaque और atheroma की बात करती हूँ. In this study, you can see the basically MAC group में total plaque formation in the total thoracic area was much lower as compared to the control group. Right, this is the plaque area of plaque formation. Similarly, plaque formation on aortic arch was also much less in those who were taking MAC. Lag phase or propagation phase of LDL oxidation, I won't go much in detail because I don't know like if you have time to explain more, but the idea is that MAC group जो भी होता है उनका LDL oxidation is much lower as compared to the control group, and the lag phase is much higher. For example, those जिन human LDL cells को जिनको pre-incubate किया था MAC4 के pace से, they had a much longer phase of human LDL oxidation as compared to control group. That means it took 8 hours on an average for the LDL to oxidize among those who were taking MAC as compared to 3 hours in those who were not taking MAC. That means MAC protects your LDL, protects you from LDL oxidation for a much longer time, for a significantly longer time as compared to controls. Again, LDL oxidation is associated with development of atherosclerosis, which is a very serious heart disorder. So those who are at risk, it is a really important information for them. Plasma lipid peroxide, matlab protection of cells, is also those who on baseline जिन्होंने MAC use किया था, उनका baseline पे much higher था lipid peroxide concentration as compared after 1 year of MAC use. Angina frequency. So angina is a disorder जिसमें chest pain is very common. Angina pectoris is basically a class of heart related disorders, and उसमें it was seen that those who were taking MAC, there was a significant reduction in their angina frequency after 6 months and 2 years of taking MAC. Also, their dependency on sublingual anginal tablets significantly reduced after 6 months and 2 years of MAC use. MAC का इफेक्ट दूसरे आउटकम्स पे, जैसे those who are taking MAC, about 1/3 of them reported कि उनकी exercise tolerance, जो एक treadmill test करते हैं physicians, उन पे चेक किया गया था, their exercise tolerance was much better and significantly better, and 80% of the patients in the study reported that their general well-being was much better, their chest pain was much better after taking MAC. Now let's talk about cancer prevention and chemotoxicity, which is the last section of our research. How does MAC deal with cancer? So cancer is a very complex disorder. It's not very straightforward, and till now there has not been a single answer to prevention of cancer, or or even a proper cure for cancer. There are chemotherapies and there are other therapies, radiation therapies, which give you some time, but a lot of patients do go back into remission, and the quality of life is severely compromised. So what can MAC do about that? MAC is associated, as I said, with a very high value of oxygen radical absorption capacity, ORAC, and a lot of superoxide scavenging, and a very strong antioxidant action, and which is highly required for somebody who is fighting cancer. So that's one way where MAC fights the cancer. Other ways where we have seen in studies is what it does is it does induce the macrophages to start killing the tumor cells. Macrophages, which basically again are defense mechanism. So MAC pushes them or induces them to start the tumor cell killing, right? MAC एक और चीज करता है, the nerve growth factor, which induces neuronal differentiation. Basically, in very crude version, what it means is it helps the cells to start differentiating. What the pattern about cancer cells or tumor cells is that they start dividing like clones, like same one after the other. What MAC helps in doing is वो एक ऐसे तरह से मॉर्फोलॉजिकली और बायोकेमिकली सेल्स को डिफरेंशिएट करने को अलाउ कर देता है सो दैट दे आर नो मोर कैंसर सेल्स per se. So these are lab studies. They have not been replicated in human rat, but still they are significant, results for us to understand how MAC can help with cancer. But directly also in animal studies, we have seen MAC reduces, mice liver carcinogenesis, mammary tumors in rats, मेटास्टैटिक लंग नोड्यूल्स जो हैं वो भी लोअर होते हैं मैक यूज से. सो इट्स समथिंग दैट वी रियली नीड टू अंडरस्टैंड दैट मैक इज नॉट सिंपली एन एंटीऑक्सीडेंट or an anti-aging product or a rejuvenator. It does much more than that, and that's what the research says, right? Directly, let's look at this study. So this particular study was conducted in AIMS, and what they did was they looked at patients who were undergoing chemotherapy and saw whether those who take MAC, are they doing better in their outcomes. So for example, in this particular study, we see that on anorexia basically means loss of appetite, right? Anorexia, in all cycles of chemotherapy, the MAC group reported much less, significantly less percentage of anorexia as compared to the control group. The control group is red and the MAC group is blue. And we see a consistent pattern where MAC group experiences much less anorexia, right? Then effect of MAC on vomiting, experience of vomiting was also significantly less in the MAC group as compared to the control group. Karnofsky performance status, which basically tells you about your quality of life or your well-being, that was much better in MAC group consistently till the end of 4th cycle of chemotherapy. Effect of MAC on tumor response, complete response of tumor, that tumor kitna regress hua, was not significant statistically, but was slightly higher in the MAC group. Stomatitis, which is another side effect of chemotoxicity, MAC group reported much less cumulative incidence as compared to the control group. Weight gain in another study was checked. This was a study which was repeated again in AIMS, and it was seen that this study looked at, because cancer patients go through this chemotherapy and they suffer from vomiting, nausea, anorexia, they experience a lot of weight loss during this process. In the MAC group, it was seen there was a significant weight gain, and the control group was pretty consistent at where it started from. MAC diarrhea ka experience, another very strong side effect of chemotherapy is diarrhea, which is the chemotoxicity associated with use of these chemotherapeutic drugs. And we see that diarrhea's cumulative incidence was much lower among the MAC group as compared to the control group. Alopecia, which is permanent baldness, was slightly lower in complete alopecia. I'm focusing on in the MAC group as compared to the control group. So now we see that I've talked about these different benefits of MAC, and it'll bring you vitality, vibrancy, your brain capacity and mental potential. The clarity will definitely improve. Immunity, of course, along with so many research benefits, will improve. Those who suffer from mental illnesses will definitely benefit from MAC. And of course, when I talk about cancer and other chronic diseases like arthritis and heart disease, MAC has shown exceptional benefits in whatever studies that there have been. Its management, prevention, and cure is definitely something that we should look at. And the future should be focused on promoting this rasayana, in the sense that I'm not saying that you start prescribing it or you start taking it. Do your research, find out how does it work, what is the reason behind it. And this is the prime reason of why we are talking today, that people want to know how does it really work. But for the future, I think it's recommended that the Vaidyas are more engaged in terms of researching our own products with bigger sample sizes and the same quality of publications as our international journals, to establish the knowledge that we have. So I would like to thank Dr. Piyush Sharma for this invitation today, and our Clinical and Outcomes Research Department at MAPPL, who helped me with this presentation, and who are the reason of why we do what we do, and bringing Ayurveda in a very research based perspective. So thank you all for attending, and I think we can open the session now for questions or recommendations or suggestions, if any you have. Thank you so much.
Thank you, Dr. Rini, for an excellent presentation. And I must say,
just a second, Dr. Piyush, let me just connect my earphone. It will be easier for me to hear.
right.
Can everybody hear me now?
Yes, yes.
Yeah.
So thank you so much for a very informative presentation. And I must say that with all these parameters which you people are doing research are very much required as far as the global, like if we are looking for a global acceptance of Ayurveda. And I request all the audience and all the doctors, I can see it is one of the most viewed session till now. And thanks to your informative talk, that so many doctors and so many like other people are also watching us live, and already we got several queries and several questions. So quickly let me start taking some questions, and meanwhile I request all the doctors and other people who are watching us, maybe you can post your questions, and accordingly we will try to resolve as maximum as possible. uh, so there is first question from, I think, Dr. Sukhvinder Singh is there. So I think he wants to specifically, as far as Maharishi Amrit Kalash is there. So this question was in the starting of the session. So now we have understood as far as immunity, it is an excellent product and definitely it helps in immunity. Let me put it in that way, Dr. Rini. We have listened to you in terms of all the research, but we all know that abhi jo ek challenging time hai in terms of this COVID, this pandemic, epidemic, everybody is talking about immunity, everybody is talking about immunity boosting. हमें च्यवनप्राश लेना चाहिए, हमें ये लेना चाहिए, हमें वो लेना चाहिए, काढ़ा है, हल्दी है. Now in the entire stuff and with this exhaustive journey of Maharishi Amrit Kalash, thoda sa specifically you can maybe emphasize, and as many people and doctors and audience have joined later as well, so thoda sa you can let us know a bit, you can maybe emphasize on the immunity boosting aspects, or maybe the studies which you people have seen. So specifically Amrit Kalash or maybe any other product Maharishi has, उसके बारे में थोड़ा सा बताएं, हाउ यू सी इन योर रिसर्च आउटकम्स दैट इट इज हेल्पिंग आउट. एंड एक इसी के साथ मैं ऐड करता हूँ एक क्वेश्चन. काफी काउंटर पार्ट्स ने और काफी फोरम्स ने इसको क्रिटिसाइज भी किया और इसको थोड़ा सा ऐसे भी पोजीशन किया कि ऐसा तो कुछ भी नहीं है, लाइक देयर इज नथिंग व्हिच कैन बूस्ट इम्यूनिटी और इंक्रीज इम्यूनिटी और हेल्प अस इन गेटिंग इम्यूनिटी. ऐसा भी कई क्रिटिसाइजेशन हमें मिला है. सो थोड़ा सा आप अपने रिसर्च एक्सपीरियंसेस के बारे में बताएं, डॉक्टर साहब.
Thank you, Dr. Piyush. So I'll talk primarily from the scientific evidence point of view, because I'm a scientist. Immunity is all there is in a person's body. It protects you from everything that is the environment outside of you, right? So I would say that it is the basis of your body on your survival, on how you live your life, how you enjoy your life. So, but immunity ka basis is, pure physiology. And what Amrit Kalash does is it purifies, and I'm talking in very rudimentary terms, in very general terms, it purifies your physiology. मैंने research तो दिखाई है कि what it does is antioxidant action है. Immunity के लिए what it does is आपका defense mechanism जो है, macrophages जो हैं उनको बढ़ा देगा. T cells की proliferation मतलब बढ़ाएगा उनको. टी सेल्स को सिर्फ बढ़ाएगा ही नहीं, उनकी क्वालिटी भी, उनकी प्राइमिंग, उनकी प्रिपरेशन इस तरह से कर देगा कि दे रिस्पॉन्ड इन अ मच मच बेटर फॉर्मेट, राइट. ऊपर से मैक्रोफेजेस जो बेसिकली किल करते हैं बैक्टीरिया या फिर कोई भी फॉरेन बॉडी होती है, उनकी एक्टिविटी को बहुत स्ट्रांगली बढ़ाता है, राइट. सो दीज आर जस्ट फ्यू साइंटिफिक रिसर्चेस व्हिच हैव शोन कि इम्यूनिटी जो है, ऑफ कोर्स इट इज लाइक we it is the basis of everything, or COVID-19 especially. So COVID-19 is, yes, it's a virus which we are not used to, right? It's a new virus and it has just come, but it also seems to be a very strong virus. It has been sustaining for almost more than a year now, right? So that means our body needs something additional over and above our usual immunity, right? एंड दैट इज वेयर मैक कम्स इन. अगर मैं आपको ये बता रही हूँ कि मैक का एंटीऑक्सीडेंट एक्शन 1000 times मोर इफेक्टिव है देन विटामिन सी एंड विटामिन ई एंड प्रोबुकल, दैट इट्स अ वेरी हेवी स्टेटमेंट टू मेक, बट इट इज बैक्ड अप बाय रिसर्च, राइट. सो एनीथिंग दैट वी से कि इम्यूनिटी कुछ भी नहीं है या फिर whatever the criticism is, but I feel like in this case of COVID-19, immunity is actually everything that we can fight with. We do have drugs that can help us alleviate symptoms of COVID-19. Yes, there are allopathic drugs which help you with fever, which help you with cold, sore throat. But what happens when they stop working or they don't work on you? There are a lot of death probability. There is a lot of death cases as well in COVID-19, especially if you're a high risk patient. So जब मैं high risk patient, if somebody with hypertension, heart disease, or diabetes is affected with COVID-19, they have absolutely no choice. They need to take something which is much stronger than the usual antioxidants or immunity agents out there.
Nice, great, and thank you, Dr. Santosh Kumar. He will be taking up to all Mumbai Ayush Hospital like this presentation, and we are getting very good feedbacks, Dr. Ini. By the way, people have found your presentation and talk very informative. So there is one more question, and she is, I think, wants to clarify or maybe understand. So, like as you have mentioned, and as we know that as far as the paste is concerned, and there are tablets as well. So we have understood this in the last session as well in terms of the clinical dosage, and Dr. Rajat clarified. So maybe in the research aspect or from that background, you can just clarify a bit on those two dimensions of Amrit Kalash. And the question is it as good as paste? The without sugar thing is as good as paste. I think it is in tablet form, which and adding to this question, there is another question that why there is a different packaging in US and in India, because I think she is talking from the perspective of US. She is residing in US. Chanchal Khosla, she is a like regular like visitor of all our sessions, and she is practicing yoga and other aspects as well. So she has mentioned that her family is also taking. So now there are two questions. Let me again put it in that way. One is regarding the dosage aspect. So there are tablets and there is a paste. So what exactly the difference in terms of research? Maybe you have seen. And second is why I think most of the packagings are, we can answer this like the US packaging, maybe for the regulatory requirements the packaging is different, but technically what we need to understand and maybe we are asking you is the inside product is same as far as the paste and tablets are concerned. Is it the same which is available across the globe, or is there any difference in the formulation as well?
As far as I know, and I can confirm this once I hear back from my technical team who handles the formulation part. But as far as I know, there is no difference in formulation. In fact, most of the studies that I've shown you today have been conducted in the US. Majority of them, out of the 75 studies, I think about like 55 to 60 studies have been conducted in the US, and they have used the product which is available in the US. Packaging requirements are different country wise, so probably that could be the reason why the packaging is different. But I assure you that you're getting the same exact same product as you are getting in India. The effects will always be the same. And the second part of the question was, I think, the dosage part. So in all these studies, the dosage varies because we are dealing with different patient populations. So, for example, the usual dosage will be 10 gram of paste plus one tablespoon of plus one tablet of the MAC5. Basically, is the usual dosage twice a day, right? But for cancer patients, we increase that dose so that they have better, because they're struggling with a lot of issues. So in there the dosage is usually double.
Fine. Now the next question, as far as you have mentioned about the cardiac aspects, so the question is from Dr. Raghu that for how many months, or maybe in general also, we need to understand in term of your research studies. So is there any duration also we can cap as far as Amrit Kalash is concerned? It can be taken on a regular basis for long term as well. Is there any long term study, by the way, as well for the safety?
Yeah. So long-term studies, like as long as 3, 4, 5 years in all the researches that I just mentioned. There are varying study periods, but for heart disease patients, the study was for 2 years of MAC intake, and it has shown brilliant results among those who were suffering from angina pectoris, and also those who are at risk of atherosclerosis. MAC will have different very very brilliant results because it has shown that it decreases the chances of LDL oxidation, and it reduces the time or elongates the time that it takes to oxidize LDL, which is a very, very big issue in heart area right now. And what better than preventing heart disease overall?
Fine. I think there is one more question. Dr. Hamid, he wants to clarify or maybe need some more information. As we all know that as far as all these antioxidants are acting as a scavenger, and as far as the free radical scavenging is concerned, so I think the one product may be the amla, which is there, and maybe other herbs also. You have a nice combination as far as the formulation is concerned. Still, see, every person in this world and many of the people are taking these kind of rasayanas. Okay, we are like fine with all the health benefits, but predominantly people are taking it to get more and more quality of life and to delay the process of aging. So in that scenario, uh, you have already mentioned in your talk and your presentation. Still, maybe you can add on something else which you want as far as the scavenging activity or the anti-aging activity of Maharishi Amrit Kalash is concerned. And apart from amla, what other maybe ingredients which you people have seen as far as research is concerned are acting or helping this rasayana as a scavenger, and it is reducing the free radicals from the body?
Hmm. So, Dr. Piyush, I won't focus much on the exact ingredients because that will take a lot of time. But in short, we have giloy, we have haldi, and a lot of other ingredients. And it's not only these individual ingredients. So that's the beauty of this combination. It's the synergy of these herbs, which basically together work as one herb, so to say, and that acts as a super rasayana. So Dr. Hamid had this question that how does it act as a scavenger? कोई भी disease या any disease population that we look at, there is always free radical damage which is to be blamed for, right? What MAC does is it scavenges, or it starts attacking these, or it starts absorbing these hydrogen peroxide, or oxygen anion radicals which are roaming free to damage all the cells around. So what it does, MAC has basically a, agar if we standardize it and qualitatively estimate what is in there, it has a lot of bioflavonoids, phenols. It has a lot of it increases the total thiols in your body. So all these ingredients basically indirectly helps you in controlling the free radical damage and the quantity of free radicals that roams around freely in your bloodstream, right? Another thing which MAC does, which I did not mention clearly in my presentation, was it surpasses the activities of superoxide dismutase. SOD एक बहुत well known enzyme है जो free radicals को बहुत अच्छे से not digest but basically degrade करती है and helps in removal of free radicals. So MAC is much stronger than superoxide dismutase in its antioxidant or free radical protecting activity. So and that's something that's shown by research. So that's these are some of the ways where it scavenges those free radicals, clears them from your bloodstream, and that's how we say that it purifies your physiology. Because the basis of any damage to the organ system anywhere in your body, the basis of it is always free radical damage.
Right. Great. So I will conclude with two more questions we have right now with us, and also we are right now heading towards our time as well. So a very good question again is there that all brand mostly have same ingredients or maybe similar ingredients. So why we can say that Mac is better? So let me start the answer, and maybe you can add on whatever you want. So the point here I want to emphasize, in fact, it's not about Mac, by the way, for all the other products and medicines as far as Maharishi Ayurveda is concerned. See, they have this world-class manufacturing unit in Noida, and I've been there several times personally, and I know the senior management and the people who are heading the entire aspects. So first of all, the entire senior management, including the owners, are very much personally involved in the raw material procurement to the processing and to the final product. So unlike other companies where the senior management and owners sit in their office and they do not visit the manufacturing plant, here they all are equally involved, and so the raw material quality check and the processing and the entire thing is very well regulated. And apart from that, they have all the certifications, and I think international standards are there, and they are the global leaders in terms of supplying Ayurveda medicines and products to the entire globe. That is point number one. Second is, as far as the formulation is also concerned, there is a bit difference in terms of Maharishi Amrit Kalash and other rasayanas or whatever the products are available. Third, as we have understood today, the entire research portfolio, I don't think so there is any rasayana right now having this exhaustive and detailed research portfolio with a global presence, because research, whenever done on any international platform, add values to any product, and definitely is very well a I will say a parameter of adding to the credibility. So I think these 2 3 points are very well to be taken when we are considering this as a differentiating factor for other products. Definitely all other companies are doing their best and they also have good products. I don't think so we are here criticizing any company, but yes, as far as Mac is concerned, it is having one of the best possible formulation, the ideal formulation, I will say. And maybe Dr. Rini wants to add something else to this question, so you can add.
I think I'll just repeat your thoughts. Whatever you said, I completely agree with it. And today's presentation is basically to make you understand why Mac is different. I'm sure the products out there will be beneficial to some extent. I'm not aware of all the products. Mac definitely has a very unique combination of herbs. There is no other formulation out there which has the same combination of herbs or the same quality of herbs. If you want more information, there is a lot of information on our website as well, maharishiayurvedaindia.com, where you can look into the details of what the how it's made, or the story of Amrit Kalash as well, how it was made. So I think I would just keep it at that. It's very different from other formulations.
Right. And the final question of the day, Dr. Rini, is again, it is related to your profile. So you have done PhD from the topic is health economics and outcome research. So what do you think as far as health economics and outcomes research is relevant in terms of Ayurveda, the significance or the relevance, or what do you think that it is like how we need to correlate this with Ayurveda? And what do you think that is this required? Definitely, it is required. We all know, but in what sense? And maybe you can clarify a bit on correlating the health economics and outcome research aspect to Ayurveda and to the entire Ayurveda fraternity. What is your message, by the way, in correlation or maybe the significance of this domain?
Yeah, I think that's a brilliant question, first of all, because I've been, I looked at this another question on Amrit Kalash, and somebody said that the price is outrageous, and I'll connect it to that. So, in health economics and outcomes research, we basically, are trying to change government policies or policies that affect individuals, or especially individuals who cannot afford some medications, they do not have the access or the money to afford such, and in that case, sure. But the thing is, I will present you a product which will prevent you, which I've shown the evidence, which has a high probability of preventing cardiac disease, high probability of preventing cancer, and improves your quality of life. If you are suffering from a mental illness, it improves your symptoms, your depression, anxiety ratings all go down. So for a product which will give you long term outcomes, and you don't have to be dependent on other medications or allopathic medications for a long period of time, which will probably cost the same as or more, in your later in your life. And as compared to that, that's what HUR does. It compares the incremental effectiveness of one product to another. So definitely in Ayurveda, to the entire world, I think we have to show that yes, Ayurveda sometimes may take longer to start acting, or may take a little bit, what do you say, it might take a lot of changing and accommodating of dosage and stuff like that. There might be a lot of variations in how it acts. But what happens with Ayurveda is that when you start comparing in terms of the incremental, especially in cost effectiveness, at the end of the day, you will find that you are doing much better off in prevention than waiting for a cure, or than waiting for a treatment later in life, when you've already developed about 2 to 3 chronic diseases, which is the usual case in India, especially, which is highly affected by heart disease and diabetes. तो HEOR का future ये है कि we need to start comparing the Ayurveda to why is it better than modern medication? Is it similar? These are the questions that one needs to ask. Is it more cost effective for you to want to take Ayurveda and do prevention, or to take depend on other medications which have severe adverse effects later in life, or whenever, and then see कि आपकी quality of life और cost effectiveness actually में कितनी improve होती है. And I think these are the kind of research studies that we need to start doing. We need to start enhancing from a policy perspective, कि what is the change that we can bring, how can we bring in Ayush and convince them that to promote research in Ayurveda overall, and especially in products like Amrit Kalash, which already have a scientific backing of more than 75 studies all across the world.
Great. I think this is very important and very significant aspect which you have just clarified, and we all need to understand more and more. And scientists and people like you can definitely add value, because we as a clinician have our own area of focus. So we need more and more people like you to develop and to standardize these parameters. So I think final question of the day, Dr. Rini, and questions are pouring in. I can see my WhatsApp and message box is also there, but we need to conclude now. So the question, I think it's a very like specific question that you have mentioned about one attention span trial which has been conducted. So Dr. Ravi Mishra wants to ask that which age group you people have taken in that study.
On the top of my head, I don't remember the exact age group, but I do remember that this was done in older adults, possibly who were older than 60, who might be already suffering from some sort of visual deficits, or, some sort of a attention deficit. Uh, but if you want specific answer, I'll need to go back to the study to answer that.
Fine. So what we will do is either we have just posted our email ID, so you people can email us. You need any more detailed information about any product or any research study as far as Maharishi Ayurveda is concerned. Otherwise, you can post your name, number, and email ID also today, and we will ask the Maharishi team to send you whatever the details are there, and any specific research study, any specific trial, any specific product details you need, do let us know. We will connect you with the Maharishi team, and they will be very much happy and pleased to send you all the research studies and details available with their products. And they have an exciting range. And I will say, apart from Maharishi Amrit Kalash, there are so many other products which are there, and very well, like they have done the research and they have done their homework in terms of uh, developing these products. And as a clinician, we always see the result, we always see the efficacy. And I'm using so many products as far as in my clinic, and many of our other fellow doctors are using from last so many years. So thank you so much again, Dr. Rini, and the entire Maharishi team, and you are heading the entire research there. So thank you so much for enabling us with these good, really good products in terms of the research. There are very less company, by the way, very few company we can count on fingers who are doing that much of exhaustive research, and in many aspects, you are the only company who are doing this much of research as far as Ayurveda is concerned. So thank you so much for this mindset and this attitude, and please continue with the same mindset in future as well. And we will be happy, and we will be very much interested to invite you again for maybe another topics and other products in future. And also, I think we will have a separate session. We will understand more, because today we have understood a basic aspect, but as far as health economics and outcome research is concerned, so we should have a standalone session, and maybe you can throw some more light and some more dimensions, that how Ayurveda and the entire Ayurveda domain and the fraternity can get benefited. So we will definitely invite you in future as well. And thank you so much for taking your time, and we know that you are a busy person, so thank you so much. And I thank all the doctors also for joining us today.
Thank you. Jai Gurudev.
Thanks. Thanks.
Thank
Thanks
you.
all the doctors for joining us today, and keep on supporting us, and we will be coming up with many more sessions like this in future. Thanks, and have a great week ahead.